Hi, good morning, Oliver. My name is Sandy Lopez. I'm your invigilator for the OET speaking session on the 2nd of February 2020. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Oliver Mason.
And what is your candidate number, please?
My candidate number is 213171153.
Thank you. And you are taking this test as a nurse? Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
What happens when you disagree with a doctor's opinion?
During a shift, I worked in the emergency room. I was reviewing a patient's chart. The prescription didn't look quite right. I immediately let the doctor know, who was in charge of the patient's treatment. However, she didn't think there was anything wrong, upon looking at the chart. I was still unconvinced that the prescription was right, so I went to my supervisor. With the help of my supervisor, we got the doctor to review the chart again. This time, she caught the mistake. In the instance that I disagree with the doctor's opinion, I make sure to take steps to determine which course of action is correct, then either work with the doctor or my supervisor to make sure that we are doing the best that we can for our patient.
What do you find the best part of being a nurse?
The best part of being a nurse is doing the job itself. It's a highly rewarding career in which I can directly help the people who need help the most, namely, those who are in pain or have some difficulty in their lives. Being there for both patients and their families is a great feeling that I can't think can be likened to anything else. The best part of it is that I'm doing something I love, and I get paid for it. I wouldn't exchange it for anything in the world.
What do you do when your opinion is asked outside of work?
My best friend would often come to me to ask questions about the migraines she was having every year around the same time in the spring. While I suspected an allergy was the cause, I asked my friend to book an appointment with one of the allergologists at the practice I worked. I stressed to her that my opinion would be less qualified than that of a specialist, who is also in the right setting to conduct tests to confirm their diagnosis.
What would your coworkers say about you?
I have a great rapport with my team, and I think the only criticism my coworkers could find is that I can get frustrated when they're not playing their part. I think they'd say that I'm hardworking, empathetic, and put patients and their concerns above all else. I also think that they'd agree that I am a team player.
Tell me about your strengths and weaknesses.
I think my biggest strength is my sense of empathy and compassion. I also believe these are crucial in nursing. As for my biggest weakness, I sometimes have trouble reaching out for help, because I do not want to bother my team members. However, I have come to learn that in many cases, reaching out for help actually saves a lot of people's time, and that everyone is willing to help each other learn and grow.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your roleplay. Don't worry if I stop you when the time is up.
Good morning. My name is Oliver Mason. I will be your attending nurse in the emergency department. May I know what brings you here today?
Nurse, I was bitten by a dog in my hand.
Sorry to hear that. Well, before proceeding further, may I know your full name, for the record please?
My full name is Sandy Lopez.
Sandy, could you please explain in detail the incident that occurred?
Sure, nurse. I was bitten by my neighbor's dog about an hour ago. The dog bit me when I went their home to meet them.
All right. Could you recall the severity of the wound, Sandy?
Actually, it broke the skin in several places.
Okay.
And I think the wound is deep because it bleed heavily.
All right. Thank you for your briefing, Sandy. Now, I would like to know about the first aid done to the wound. For example, wound cleaning, application of any antiseptic, or ointments like that.
I didn't try to clean the wound, as it was bleeding too much.
Oh, I see.
Instead, I covered it with a sterile pad and applied pressure.
Okay. I understand.
Also, I haven't used any cream.
All right. Have you taken any painkillers?
Well, nurse, I took 2 paracetamol tablets just after it happened, but it is still very painful.
Don't worry, Sandy. We will be proceeding with the treatment very soon. Kindly pay attention to me as I summarize what I have heard.
Okay, nurse.
You were bitten by your neighbor's dog about an hour ago. In several places, the skin was broken and was bleeding heavily.
Okay.
You didn't clean the wound. Instead, you just covered it with a sterile pad and applied pressure.
Yes, exactly.
You also took 2 paracetamol tablets. Am I correct?
Yes, you are, nurse.
Is there anything else you would like to add?
No, nurse.
All right. Now, I will explain the treatment procedures for you.
Okay.
Firstly, I can clean the wound, so that assessing the wound would be much easier.
Okay.
After that, the doctor may send you for a blood test. It is to check the chance of infection.
All right.
Thereafter, the doctor will examine your wound and prescribe appropriate antibiotics and pain relief medications.
All right, nurse.
After the doctor's examination, if needed, an X-ray will be ordered. It is to check for bone and tendon damage.
Okay, nurse. I got it.
By the way, we recommend a tetanus booster. So, could you please tell me when you had your last tetanus booster injection?
Well, I don't remember when I had one. So it's okay for me to take tetanus.
All right. That's a very good decision.
Nurse, may I know how many stitches I will need?
Your thought is sensible. However, according to the current medical practice, for the wounds from animal bites, no stitches are initially recommended.
Oh, really?
Yes, Andy. It is because the wound will be easier to clean, and also less risk of getting the infection.
I am really glad that I don't need any stitches.
That's great. Sandy, the doctor will confirm treatment of the wound on examination. Kindly stay calm as the doctor will consult you shortly.
Okay, nurse.
Sandy, you need to come for a review after a few days.
Okay, nurse.
Thank you for your cooperation.
That is the end of your OIT speaking roleplay. All the best.
Thank you.
Thank you for watching. Please like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.